Welcome to Medical Spa Insider. I'm Kathy Christensen, President and CSO of AM Spa, and I'm happy to welcome you to this very special podcast featuring 4 leaders in the medical spa industry who are also featured speakers at the upcoming Medical Spa Show 2025. This week, we are so pleased to chat with Medical Spa Show speakers Gilberto Saenz III, PAC of Austin Plastic Surgery, Bree Black of JobSnob, Johnny Franco, MD, FACS of Austin Plastic Surgery, and Judy Kozlicki of Skytale. Before we kick things off, we would love to give you the chance to see these faculty members, as well as all of our other speakers and exhibitors while enjoying the parties, networking, and fun in Vegas at MSS. As a Medical Spa Insider podcast listener, we're offering you 10% off registration. Just use the code Medical Spa Insider MSS25, all caps, Medical Spa Insider MSS25, all caps, as a promo code when you register at www.medicalspashow.com. Without further ado, please welcome Gilberto Saenz.
Hi, my name is Gilberto Saenz III. I'm a dermatology and plastic surgery physician assistant with Austin Plastic Surgeon in Austin and San Antonio, Texas. I'm so excited to be a speaker at AM Spa's Medical Spa Show taking place April 11th through the 13th, 2025 at the Wynn Resort and Casino in Las Vegas. I've been in the medical aesthetics industry for 20 years, and the business or clinical success that I'm most proud of is growing my patient following by developing lasting relationships with my patients. Early in my career, before transitioning to aesthetic medicine, I was a family medicine PA. This experience set the foundation for me as a medical provider. These patients became like family to me, and this mindset carried over to my aesthetic career. I truly believe that this is what will set you apart from other providers and really cement your career in aesthetics. If you treat your patients like you would treat your own family members, at least the ones that you like, you listen to your patients in what they're hoping to achieve with their aesthetic treatments. You are transparent and honest with them about what is realistically achievable and can give them extraordinary outcomes. Not only will you have a patient for life, but your patients will become your greatest referral source and your greatest asset. I would say my biggest business or clinical failure, and the lesson I learned from it, was trying to cater to every patient's unrealistic expectations and bending to trends that didn't align with my principles. The result was burnout, frustration, and outcomes I wasn't really truly proud of. I'd say the lesson was that success in aesthetics isn't necessarily about saying yes to everyone. It's about having the confidence to say no when necessary and right. I learned that staying true to my expertise and values not only builds trust, but attracts the right patients. I've taken great pride throughout my career in creating a legacy of excellence in education that inspires both my peers and my patients to demand more. I invite you to come check out my sessions at Medical Spa Show 2025. My first class is taking place on Friday, April 11th at 4:25 in the Legal Playbook Best Practices and Beyond track. The title of that panel is Implementing a Successful Weight Loss Program. And during this session, we will be covering, as the title suggests, the full gamut of instituting and implementing a successful weight loss program into your practice. As we know, the weight loss revolution shows no signs of slowing down, as there are currently over 50 GLP-1 medications in clinical trials for approval to come to market. We have only seen the tip of this iceberg, and there are so many exciting things in the future as it applies to weight loss and aesthetics. On Saturday, April 12th, from 9:35 to 10 a.m. in the Aesthetics Industry Game Changers track, I will be teaching the class Cellulite, the New Frontier of Combination Therapy. I'm super excited to share the amazing combination treatments that we are providing our patients to address their cellulite and skin laxity concerns. We'll dive into the causes of these skin issues, the variety of treatment options that we offer, and best practices, as well as how to implement these treatments into your practice to create more opportunities to expand and grow your business. Also on Saturday at 3:50 p.m. in the Clinical Innovations 1 track, I will join a panel of my highly respected colleagues called The Worst I Ever Had: Complications and How to Overcome Them, with Jenna Hartley of Skin Synthesis Clinic and Spa, Jenna Hilton of Healthy Balance, and Julie Bass-Kaplan of Disappearing Act. I hope you'll join me. See you at Medical Spa Show 2025.
Hi, my name is Bree Black, and I am one of the founders of JobSnob. I am so excited to be a speaker at AM Spa's Medical Spa Show. I've been in the medical aesthetic industry for over 10 years, and the biggest business success I've had, or that I'm most proud of, is founding JobSnob. My business partner, Kipper, and I met when we were working with Allergan on the facial aesthetics team. And we realized that there was a true need for a staffing or recruiting resource that was specific to medical aesthetics. And between the two of us, we had many, many years of experience. We worked in a corporate setting. We had long and successful careers, and walking away was a big risk and a challenge. But here we are over 5 years later, and JobSnob's now nationwide. We have a team of recruiters, and we are fortunate enough to work with so many different practices across the country. The biggest failure I would say that I've had from a professional perspective would be, I guess ironically, making some bad hires along the way. In those situations, I can definitely point to a time during the early stages or interview process where I could have followed my gut instinct, or I probably knew deep down that these people weren't going to be the best culture fit or weren't well aligned with our company. And had I listened to my instincts, probably wouldn't have made those mistakes. But on the flip side, it was a great learning lesson and taught me to really follow my instincts, trust my gut, and make sure that I am true to our core values during the hiring process. I'd love for you to come and check out our session at the Medical Spa Show. My class is taking place on Saturday, the 12th at 4:25 p.m., and that will be in the Strategic Leadership and Effective Management Practices track. I will be part of a panel titled Hiring, Retaining, Compensating, and Managing Your Aesthetic Team. And during this session, I will be with a group of other professionals, and we are going to discuss some best practices for hiring, as well as current trends, what we're seeing out there in terms of compensation, how to structure an effective compensation plan, as well as really, what's the best way to develop your team and keep them engaged and motivated. We would love to have you there. Again, it's April 12th, which is Saturday at 4:25 p.m. And I hope to see all of you there. Thanks so much.
My name is Johnny Franco. I'm a plastic surgeon at Austin Plastic Surgery. I'm so excited to be a speaker at AmSpa's Medical Spa Show. I'm going to be talking all about medical weight loss and the implications of it. Also, I have a panel talking about ethics and how we can fit into this. And I think it all ties so well together. But let's jump into a little bit about the weight loss overall and what we're going to be talking about in part of our panel, because there's not a topic that has, hit home so hard as weight loss. And as you'll see, it's because of a couple of things of how many people it actually affects. So we're going to go all through the weight loss revolution, how people have integrated in a safe and legal way, and then whether you truly have a prescription or a program. I think we're at such a pivotal time in aesthetics and plastic surgery to really be able to solve problems for patients and practices. Weight loss has been such a hot topic because we've never had anything in the aesthetic industry that has affected so many people. There's not someone in our lives that that's either not personally affected by this or that's one step away from us. And so I think that's why we've seen so many people involved in this conversation. There's this whole topic of the Ozempification of aesthetics, which is near and dear to my heart, because if you think about it, it's such a unique patient population, and with that becomes challenges. We have young patients that are losing weight, and a lot of the issues that we typically associate with older patients we're seeing in very young patients. So their needs are evolving. You're seeing new challenges, but also you see technology and AI and how all of that is integrated. And I think that's where some of these panels are absolutely priceless in terms of being safe, methodical about how you're going to do that in a very sophisticated way. There's all sorts of places to be along in this weight loss journey. And this is probably one of my favorite slides because, you can talk about it from the weight loss medication itself, from volume loss, skin laxity, surgery, all sorts of different places along that journey where as an aesthetic provider, you can intervene. We're also seeing so many patients that I would call aesthetic naive patients. These aesthetic naive patients are new to the aesthetic field. They're new to the arena in terms of this. And so really our job to educate patients about, that journey, where they're going and how we can help them along that, because they're going to see new challenges that they probably didn't expect during their weight loss journey. These aesthetic naive patients are going to have some unique challenges. You're going to have to speak to them in a way that matters. I think you're going to have to be able to track them and really educate them along a specific time course, because many of them are not going to be interested in treating skin laxity, volume loss, when their biggest issue is weight loss. But I think there is a way for us to speak in a meaningful way that's going to be helpful to them. Also, such a pivotal time in plastic surgery. We're going to be going through so many things, and this is why I love, the medical show here at Spa, is that, you have the wellness wave, you have the skin laxity, volume loss, tech and AI, unique population. So, with all these unique pivot points, how do we help them along this? But there's going to be a lot of challenges. Skin laxity at different ages, these volume loss. So whether it's from, non-surgical, surgical patient populations, so all sorts of different ways for us to be able to help those patients. I also think, with the weight loss revolution, you're going to see these aesthetic solutions. It's on us. There's a second cosmetic wave coming. We're going to see it as these patients have been on these GLP medications. They're going to start to see these secondary effects. They're going to want to treat them. So we've already seen it in our practice already. You're going to see a shift with so many new technology. I think that it's going to continue to improve, continue to get better. I also think you're going to see a change in what patients want. No longer wanting to be overfilled. You're going to see structural support is going to be such a hot term, because patients want to look good, but they don't want to be overly filled, and that's gone away. They love the natural feel. So you're also going to see more excisional surgeries. You're going to see a lot of combination treatments to help patients get the results they want. I think muscle matters. That's going to be a huge topic. How do we integrate that in a way that's truly helpful for patients, that really is meaningful for them, and getting through that, because I think with weight loss and the GLPs, it's been such a hot topic. You've seen patients really think about, a functional fitness, and so no longer having to be so fit on like what visual changes they're going to see, but actually, do they feel better? Are they feeling stronger? And I think that's something that's truly going to resonate, and something we need to be talking about if we're truly caring about their overall health and well-being, which, I think the GLP has opened a huge new world beyond just weight loss and this whole fitness transition. There's all sorts of muscle devices out there. And so, we can dive into those during some of these panels. I think the male patients, it's been a hot topic, but again, how do you integrate the male patients into your practice? Because weight loss is something that truly resonates with all those patients. And so now trying to get them to a great spot, skin laxity in for those patients. And not all of them are looking for circumferentials, tummy tucks, those things, but there are ways to treat them that it's meaningful. I think with the Ozempic phase, you're going to have so many these collagen combos, combination treatments to really give them a great result in a non-surgical way, because that's going to be a huge ask, a big demand for patients. Though I do think facelifts are going to explode in numbers over the next year or two. You're also going to see the lower extremity continue to be a huge portion of this. And so really trying to integrate some of these treatments, because a lot of patients see cellulite as anything they don't like of their lower extremity, legs, butt. And so being able to treat that in a way that's super meaningful, because with weight loss, they're going to see these skin laxity changes to their butt, legs, and thighs. They're going to call it cellulite, but it's really our job to drive them into a great spot and be able to treat them in a meaningful way. Obviously there's patients that are going to need surgery. There's some new skin excision and treatments that I think are going to be super powerful, super impactful for them. I think you're going to see this evolving trend from this Ozempification, patients, their body, they're trying to look for these more fitness looks in terms of, that's why you've seen more high definition lipo. You've seen some non-surgical ways to do some of that too, which is super exciting. We have this concept we call the Pilates bodies, in terms of patients looking for more athletic, looks instead of the overly done, overly full look. I think, looking for ways to measure that success in ways that we can talk to patients and be upfront about them. Because if they're aesthetic naive, they're going to struggle to know what we can actually do or not do. And I think we're going to have to be able to guide them along that journey. I think finding ways to speak to them in a way that truly resonates is going to be super impactful. The future is really going to talk about how do we diversify these programs, and this is where Michael Bird and his team are going to help us set something up for success from a legal perspective with the medications, the new opportunities. I think there's so many evolving changes, and so you want to figure out where you want to be in part of this conversation, but then you need to make sure that you set up the framework to keep yourself out of trouble. And I think that's going to be challenging because there's so many new changes, and making sure that you're updated on that. So really, the checklist of this is going to be, making sure that your website's compliant, make sure your social media is set up for perfection, and make sure that you're in a perfect spot for all of this, to get what you need. Make sure that your team is trained in the right way for all of this. So can't wait to see you guys. Super excited. I invite you to come check out my sessions at the Medical Spa Show Friday and Sunday. My classes take place on Friday, April 11th at 4:25 in the Legal Playbook, Best Practices. And then also on Sunday, basically, what do we do to preserve our ethics in the aesthetics world? So super excited to share all this with you guys. We'll see you soon.
Hi, everyone. My name is Judy Kozlicki, and I'm the head of Medical Aesthetics, Wellness, and Plastic Surgery Consulting for Skytale Group. I'm super excited to be speaking at AmSpa's Medical Spa Show. I have been in the medical aesthetics industry for about 18 years now. I've led a national med spa expansion from 1 to 33 locations, as well as led both solo and small group plastic surgery practices through significant growth and scale. I think the work that inspires me the most is helping individuals and organizations become as successful as they possibly can be. When organizations experience rapid growth, a lot of gray area kind of comes about within roles and responsibilities and confusion and overlap in duties. And my goal is always really to understand each individual, what their strengths are, and streamline both their roles and responsibilities, aka job descriptions, but also operations, so that everyone works together to create the most possible successful practice as a whole. So you can imagine your employees are really, truly your biggest asset. So investing in them and really honing in on their strengths will only make your practice that much better. One of the biggest mistakes or challenges I've had as a leader in this industry was hanging on to a truly high-performing provider that was causing a lot of toxicity in the workplace. I think if you've been to Kathy Christensen's talks at the boot camps, you'll always hear her share the Simon Sinek clip that compares the high performers to low trust and puts these employees all on an axis. And I can honestly say from firsthand experience that hanging on to a high performer, even though they're causing a lot of ruckus within the practice, is not worth it. They will do far more damage. And the old adage does hold true to hire slowly and fire fast. I'd love for you to join my session at the Medical Spa Show this year. It's taking place on Friday, the 11th at 3:50 p.m. in the Business Performance Dashboard, Financials and KPIs track. The title of my talk is How Knowing Business Key Performance Indicators, or KPIs, will maximize your revenue. In this session, we will learn what are the most important financial and operational KPIs to track. I'll provide tips for finding this data and how best to share it with your team. I'll even provide some real-life case studies from my practice days and/or clients that I've worked with, so you can see how measuring and managing these KPIs will positively impact your business.
Don't miss Medical Spa Show 2025, April 10th through the 13th at the beautiful Wynn in Vegas. Use code Medical Spa Insider MSS25, all caps, as a promo code when you register at www.medicalspashow.com. See you there.